Hormones are the chemical messengers of the body that tell our different body parts what to do. So each of these hormones have a role in reproduction. So gonadotropins include the follicular stimulating hormones, luteal hormone, and HCG, which is the pregnancy hormone. Estrogens are involved in the development of secondary sexual characteristics and the regulation of the menstrual cycle in females. Estrogens also play a role in modulating libido, erectile function, and spermatogenesis in males. Progesterone prepares the uterus for pregnancy by thickening that endometrium so that a fertilized egg can implant. It helps to maintain pregnancy in the early weeks, and it should increase as the pregnancy progresses. Now, in males, progesterone assists in sperm production and enhancing testosterone levels. Testosterone maintains the libido in males and females and is responsible for development of males' secondary sexual characteristics and spermatogenesis in males. Now, it does play a minor role in females, but it's not that significant. Prolactin is produced in the anterior pituitary gland. This is what caused the mammillary alveoli to produce milk. And then oxytocin is involved in stimulating smooth muscle contraction, and it also plays a role in labor and milk ejection. The HPG axis is a feedback loop that makes sure all of our reproductive hormones are produced and released at the proper time. So sometimes you may have someone that has a reproductive hormone imbalance. So it could be because of things like genetics. Lifestyle factors could be exposure to environmental toxins, medical conditions, medications, age, obesity, any chronic health conditions. So some manifestations of hormone imbalances for females are things like vaginal dryness, irregular menstrual cycles, infertility, hirsutism, which is excessive body hair, acne on their chest, upper back, and or face, hair loss, hot flashes, vaginal atrophy, and loss of interest in sex. Now, in males, the hormonal imbalances can be things like erectile dysfunction, decrease or loss of body hair, infertility, gynecomastia, which is enlarged breast tissue, loss of muscle mass, and loss of interest in sex. So we have some different classifications of hormones that we are going to look at. Estrogen therapy, estrogens, estradiol, this is produced by the ovaries. Our mechanism of action is that estrogen is going to attach to specific estrogen receptors located in the various tissues, including our reproductive organs, breast, hypothalamus, and pituitary gland. Estrogen is going to produce secondary sex characteristics in the females, and that's going to include the development of breast tissue. It also helps to thicken the endometrial lining of that uterus so it can prepare for pregnancy. It helps in regulation of the menstrual cycle, maintains the mucosal cells of the vulva and vagina, and aids in urethra and bladder health. It also prevents osteoclast activity, increases HDL, and decreases LDL. So why would we use it? It's used for moderate to severe manifestations of menopause, correction of hormonal imbalance in those who might have uterine bleeding, oophorectomy, and those that are undergoing gender-affirming care. Contraindications are going to be people with a history or risk factor for thromboembolism, if they have suspected or confirmed breast, vaginal, cervical, endometriosal cancer, if they're having vaginal bleeding and we don't know why, liver disease, hypertension. Some of the side effects, quite a few of them, nausea, hypertension, edema, urticaria, oily skin, gynecomastia, which is enlarged breast tissue, breast tenderness, vomiting, anorexia, weight changes, amenorrhea, dysmenorrhea, loss of libido, hypercalcemia, leg cramps, hyperglycemia, erectile dysfunction, and testicular atrophy. Now, estrogen does have a boxed warning for the increased risk of endometrial, breast, and ovarian cancers, and also cardiovascular disease. So we want to talk about the medication, and if they're taking a transdermal patch, we want them to put it either on their lower abdomen or on the trunk of their body. We also want them to stop smoking. Now, closely with this is going to be our progesterone therapy. The mechanism of action with that is it's going to change secretions in the endometrial lining. So progesterone causes that thickening of the uterine lining. So if you're taking progesterone, you might have a lighter or no menstrual cycle during the course of therapy. We use progesterone in treatment of pain-related endometriosis, dysfunctional uterine bleeding. We can use it as hormone replacement therapy and endometrial carcinoma. It's also used sometimes for people to maintain a pregnancy if they have a naturally lower progesterone, or we can use it to prevent a pregnancy from occurring, which I know sounds indicative. Contraindications would be the medication interactions, meds like rifampin, ritonavir, phenobarbital, carbamazepine, phenytoin, and St. John's wort. All of those will decrease the effectiveness. Common side effects you're going to see are breakthrough bleeding, other menstrual irregularities, nausea, constipation, edema, headaches. They can get headaches. The most serious adverse effect is going to be that thromboembolic disorder. They might have some hypersensitivity like anaphylaxis or angioedema. We want to talk to them about the medication. We want them to be very mindful of doing monthly breast self-exams and getting mammograms because progesterone can increase their risk of cancer development. We also want them to report any leg or chest pain, leg swelling, sudden change in vision, severe headaches, or shortness of breath. Now, you may see estrogen and progesterone used together to relieve some manifestations of menopause and treat those postmenopausal osteoporosis. In a combination, we can use progesterone for hormone replacement therapy for those that have a risk of thromboembolism and acute myocardial events. Those are greater than for just estrogen alone. Testosterone therapy, some examples here are going to be depo-testosterone and androgel. Now, testosterone exerts biological effects. It binds to the androgen receptors of the body. So with males, it's going to increase their secondary sex characteristics, as we mentioned earlier. It helps with increased muscle mass, bone mass, fat distribution, cognition and mental well-being, and production of different cells. So some reasons why we might give this out is maybe we have someone who has delayed puberty or hypogonadism. If we have an androgen responsive breast cancer, we can use this for palliative care and gender affirming care for transgender men. We can also use it to treat low sex drive for both males and females. Now, of course, our contraindications are going to be those that are pregnant, those that are breastfeeding, if you already have breast cancer or prostate cancer, uncontrolled heart failure, if they've had a MI or stroke in the last 6 months, and obstructive sleep apnea. Side effects for males, you will see a deepening of their voice. They might have acne, facial hair. They might have some erectile dysfunction, breast growth. They might get some edema. For females, they might have some enlargement of the clitoris, change in their libido, decreased breast size, and maybe some generalized edema. Adverse effects that we would see would be a deep vein thrombosis, liver toxicity, stroke, suicidal thoughts, and pulmonary embolism. So we want to talk about this medication. And again, if they're using a transdermal patch, The appropriate places are their upper arm, back, abdomen, or thighs. We want them to wash their hands after they apply it. If they're using the oral medications, they can apply it to their gums, putting pressure on it for about 30 seconds. We want them to go to the ER directly if they feel like they have a DVT, which would be like unilateral swelling, redness, and pain in their calf. Now, testosterone can cause fetal harm, so we want them to stop taking the medication and let the provider know if pregnancy is suspected. So next we'll talk about contraceptives. Contraceptives provide improved health and well-being and planned pregnancy spacing, which is going to be better for maternal and newborn health. So we have some different types. The first type is the combined estrogen progestin contraceptives. These are going to be things like our orthotricycline, our Yaz. This is a synthetic form of the estrogen and progestin, and it prevents ovulation, which is going to prevent pregnancy from occurring. You might have a contraceptive patch, which would be something like norelgestromin or ethinyl estradiol transdermal patches. That is a topical form of birth control that's going to deliver estrogen and progestin over the course of a week, which will, of course, suppress ovulation. We also have the contraceptive ring, NuvaRing and Overa. This ring is inserted in the vagina to provide contraception for a month. It has a low dose of estrogen and progesterone. Now, hormonal contraceptives release hormones that are going to stop that ovulation. It's going to thin the lining of the uterus and thicken cervical mucus. So that is going to inhibit ovulation, cause that uterine lining to thin, and of course that cervical mucus is going to become a lot thicker. Again, we want to use it to prevent pregnancy. However, if we have somebody that has something like acne vulgaris, menstrual disorders, endometriosis, they can also use it for those as well. Contraindications would be someone who's already pregnant, someone who's breastfeeding in the first 4 to 6 weeks of postpartum, history of breast or endometrial cancer, uncontrolled hypertension, people that are older than 35 years of age who smoke cigarettes. We don't want them taking oral contraceptives. In fact, smoking and contraceptives is a very risky endeavor. Some of the side effects we're going to see are nausea, vomiting, stomach cramps, diarrhea. They might have constipation, changes in their appetite or weight, bleeding, spotting, missed periods, breast tenderness. If they're using the patch, it can cause redness or skin irritation or rash at the application site. The ring can cause swelling, redness, irritation, burning, or itching of the vagina, and yellow or white vaginal discharge. So adverse effects are going to be things like lethargy, severe headache and vomiting, weakness of the arms or legs, swelling of the legs, hands, feet, dark colored urine, unusual or heavy menstrual bleeding or bleeding that lasts more than 7 days. So we want to make sure that we talk to our clients about this medication, making sure they take one every day. Don't miss a dose. If they begin to miss too many doses, it's going to cause them to start their period again. We want them to report any severe headaches, mood changes, chest pain, vision changes, leg and pain or edema. Progestin-only contraceptives, norethindrone, the ones that are injectable, the medroxyprogesterone, or what you may have heard referred to as Depo-Provera shot. We can also do the implanted progesterone-only contraceptives, which would be something like the Nexplanon or the NuvaRing. We also have the IUD, levonorgestrel, commonly heard as maybe Mirena. So these progestin-only contraceptives act by suppressing the GnRH, luteinizing hormone, and follicular secreting hormone secretion from the pituitary gland. So that's going to stop ovulation from occurring. These contraceptives are going to prevent the sperm from reaching the egg. We're going to use it again to prevent pregnancy. Some other things that we might use it for is if we have someone with heavy menstrual bleeding, painful periods, irregular menstrual cycles, and endometriosis. Of course, contraindications would be if you're already pregnant, you've had past or present breast cancer, if you have unexplained vaginal bleeding, liver disease. If we're looking at the injectable contraceptives, if you have thrombophlebitis or cerebral vascular disease, we don't want you to use those. IUDs, if you have or suspect pregnancy, of course, we're not going to let them use that. If you have congenital or acquired uterine anomaly, it's not going to work for you. Breast cancer, again, pelvic inflammatory disease, or postpartum endometriosis. Common side effects are going to be those irregular periods, breast tenderness. You may see some other things like headache, weight gain, nausea, dizziness, acne, and increased hair growth. Rare adverse effects would be something like a thromboembolism, a heart attack, can increase your LDL and decrease your HDL. For the injectables, you can get angioedema, anaphylactic shock. The implanted, there's always a chance that they might become displaced or have a failed insertion, which will cause you to become pregnant. Also, if you're using an IUD, your risk for an ectopic pregnancy is increased. So again, talk about the purpose of the medication, how we're going to give it, anything that they need to be aware of. For each woman, it's very important that they consult with their provider in knowing what will work best for them. And then lastly, we'll talk about emergency contraceptives. The Plan B one step is the one that is available over the counter. It is a progesterone only pill. It's going to suppress that luteinizing hormone, so it's going to stop the ovarian follicles from receiving anything. They inhibit ovulation so that therefore we won't have fertilization. When would we use it? Well, it's to prevent pregnancy after unprotected intercourse. We can use them for up to about 5 days after unprotected intercourse if we're using some of the ulipristal emergency contraceptives. The progesterone only, which is like the Plan B, they're most effective within 72 hours or 3 days. So contraindications would be, of course, if I already know that I am pregnant or I have liver disease. Some side effects they might see some breast tenderness, changes in their menstrual flow and periods. They might get a headache, nausea, vomiting, fatigue. Our adverse effects is there is a risk of toxicity occurring. So we want to talk to them about this medication. One of the important things we want to tell them is they need to notify their provider if they vomit within 3 hours of taking this medication, because that has not given the medication enough time to absorb, so they're probably going to need another dose. We also want to make sure they understand the time frame in which these emergency contraceptives can be taken to be effective.